Was there a moment in medicine when science and all these solutions became more about systems, power, and access than just medicine?
think I think in residency maybe. So I did residency at University of California, San Francisco, and we get to practice in different hospital systems. So we get to practice at the main hospital, at the VA, the Veterans Hospital,
Mm.
and then also at the Safety Net Hospital, which has a lot of um, it's a safety net hospital. So really, people who are uninsured, underinsured, recent immigrants, but I think, for me, it was just realizing how, I think it was the first time that it really hit me that people who live within the same city can have very different access to medicine. Like we were literally the same providers going through these three hospitals, but the patients that you see are so different. You go to San Francisco General Hospital and you're seeing patients coming in with malaria TB and it's like, like just or like advanced presentations, but in a way, you're just like just across the street, they're like having women with like sub-centimeter tumors, and here, the women presenting with fungating masses, and so I think it just made me realize how, and the U.S. system is unique in that way, but it just made me realize how poverty is just like one of the biggest determinants of health, like that shapes the kind of care people get in the US fundamentally. And it doesn't play out, sort of on a macro scale where you're like, oh, in urban cities, people get this care, and in rural areas, they get it. Like even within the same urban city, within the same hospital affiliation, there's sort of different levels of care that people get based on their insurance status, based on what's covered within their insurance status. But ultimately, I think poverty, people's lived experiences where they live, still dictate like their outcomes from cancer. And I think that's really disturbing for me.